I did walk in today with a face covering. Wear that wherever I go publicly, events where I cannot socially distance, physically distance from others. But as many of you know, just a few days ago, state of California advanced an effort, guidelines that came from our health department to mandate face coverings in exterior parts of the state and areas where you may be recreating but otherwise cannot practice social distancing, physical distancing, and indoors to the extent, again, that you're mixing with cohorts of individuals that you otherwise may not have been previous to our modification of the stay-at-home order. The reason we're doing this is simple. Wearing face coverings saves lives. It mitigates spread. I think it's remarkable, just looking at this slide itself, the impact that we have as individuals, even when we exhale. You can just see from this slide, just taking a deep breath and exhaling, droplets can go as far as 4.5 feet. Coughs, that infamous 6-foot number. But look at that sneeze. When we sneeze, it goes far, droplets of 26 feet. It underscores the magnitude of opportunity we have as a state, I argue as a nation, to be more thoughtful, not only about ourselves, but about others when we are in public, when we start to mix cohorts, as we reopen the economy here in the state of California and all across the nation. I've had the privilege over the course of the last number of months to spend time with 4 ex-governors, living governors in the state of California. Governor Wilson, Governor Schwarzenegger, Governor Davis, Governor Brown. They've been advising me, advising our economic recovery task force. I've had the privilege of getting to know them personally. You have all gotten the privilege to get to know them professionally. 2 Republicans, 2 Democrats, and all concerned about where we are in this pandemic with COVID-19, where we are going. And as a consequence, they were generous enough to put together the following video underscoring the importance of face coverings.
Hey, maybe you didn't vote for me.
Arnold, newsflash, I voted for Gray Davis.
But no matter who you voted for, or if you didn't vote at all, it doesn't change that Californians look out for each other.
Look, nobody wants to wear these things.
And thankfully, masks have come a long way since the last pandemic.
This is not about being weak.
It's about fighting the disease and keeping our families and ourselves safe.
And it's about getting Californians back to work.
And small businesses open safely.
COVID-19 is still spreading.
It didn't go away just because your mall is open at 50% capacity.
This isn't over.
It's up to all of us to fight it.
So do your part.
Don't let COVID win. Wear a mask.
Just do it.
Just do it. We are experiencing and have experienced just over the last 14 days some 35.6% of all of the cases. They have been reported just in the last 14 days, 46,000 plus new cases. Take seriously this new mandate to wear face coverings, to listen, not to me, perhaps you are more fond of some of those other governors. We had a record number of tests we conducted yesterday, over 92,000 tests done yesterday, 85,000 tests done the day before, 79,000 tests the day before that. That's the blue part of this graph. The testing is going up and up and up and up. But that doesn't tell the entire story. We're starting to see slight uptick in the positivity rates. Not where it was. You'll see that red line, the 40.8% on the graph. But the positivity rate, nonetheless, that's been stable, is now going slightly up. Accordingly, we're starting to see an increase in hospitalizations. Total number of cases are going up in the state of California. Total number of positive cases relative to total number of people tested is going slightly up. Hospitalizations are starting to go up in the state of California, reflected in this slide. Accordingly, number of ICU patients has also seen an increase, a little more modest than hospitalizations, but nonetheless an 11% increase over a 14-day period. Wear your masks, practice physical distancing, continue the hygiene that is so foundational in terms of mitigating the spread of this virus. We are not out of the first wave of this virus. We're not discussing yet the second wave because we still need to work through the first wave of this virus. You'll see on this slide that we have a surge capacity of over 52,000 beds. We currently have, even with that 16% increase in total hospitalizations, the 3,702 number you see there, total number reflected is still a very modest subset of total number of available beds. We're in a position to absorb even greater increases. So I want you to know we're managing this. We're focusing in a very deliberative way on addressing not only the mitigation, but addressing the reopening of economy where people are mixing, and the likelihood will continue that we'll see an increase in total number of positive cases, and by extension, a subset of that in hospitalizations. So again, despite an increase in hospitalizations, despite an increase in total number of ICU patients, our capacity remains fairly stable compared to where it was a week ago, and certainly is in a much better position than we were a number of months ago. So we continue to advance more work to reopen the economy, but safely and responsibly. And it's incumbent upon all of us to really take heed these documents that we put out. Not sure everybody paid deep attention to the fact that we put out 38 guidelines around developing strategies to safely reopen this economy since the beginning of the pandemic. We now have 54 counties in the state. These 53 attestations, there's an attestation for 2 counties, forgive the confusion, but the vast majority of counties have moved forward by taking our guidance, which again does not prescribe when to reopen, it just lays out how to safely reopen, and they have implemented their protocols and procedures through that attestation process that, again, is available online at the covid19.ca.gov website, covid19.ca.gov website, where you can go to your county and see how they're performing vis-a-vis their own attestations.